Hello viewers, I'm Dr. Nagesh, consultant endocrinologist, Nagesh Diabetes Thyroid and Endocrine Clinic. I'm here today to discuss 5 important questions about hypothyroidism with you. The first question which many people ask me is, what is hypothyroidism? Hypothyroidism is a condition where your thyroid gland, which is present here in the neck below the thyroid cartilage, does not produce enough of the thyroxine hormone to take care of your daily activities, and consequently we have to supply some amount of thyroxine to your body in the form of a tablet so that it can replace whatever amount of hormone is not being produced by your thyroid gland. The commonest cause of hypothyroidism earlier used to be iodine deficiency, but now that everybody is using iodine salt, the commonest cause is now an autoimmune thyroiditis, also known as Hashimoto's thyroiditis, which is a mild condition where your body's immunity acts against and destroys your thyroid gland. Another condition which commonly causes hypothyroidism is congenital hypothyroidism in children, where some children are born either with an absent thyroid gland or a poorly functioning hypothyroid gland. Rarely, genetic defects can also cause hypothyroidism. The second question many people ask us is, do I gain weight in hypothyroidism? Not really. The maximum adjusted weight gain that you see in hypothyroidism is to the tune of 300 to 500 grams only. In severe hypothyroidism, when your TSH levels are more than 100, a few people may gain 2 or 3 kilos because the body retains the water. The minute you start them on thyroxine replacement, this water is immediately excreted, and within a month or two, you get back to your pre-hypothyroidism body weight. Many women actually ask me the third question, will it affect my fertility or will it have an impact on pregnancy? If improperly treated or if not treated, hypothyroidism has an impact on fertility. You can be infertile, or even if women conceive, they can have recurrent abortions. But this is a very easily treated condition. Starting thyroid tablet, monitoring your TSH levels and T4 levels, and increasing or decreasing treatment appropriately to ensure that your TSH is below 2.5 or 3 microunits per ml will totally eradicate all the side effects with regard to fertility and pregnancy associated with women, and you can go ahead and have a normal and a safe pregnancy if you are properly treated and on regular follow-up with the endocrinologist. The fourth question almost all my patients ask me is, do I have to use this hormone for life? In a majority of cases, the answer is yes. Very rarely, if people are started on thyroxine therapy when the TSH is just above the upper limit of normal, or if women are pregnant and they have a very mild hypothyroidism and this hypothyroidism remits after pregnancy, they might not need to be on this hormone for life. But in all other cases, this treatment is almost always for life. And if you really have any doubts about it, you can get the thyroid antibodies tested, which will give you a better picture as to whether the patient has to use this hormone for life or not. And the last and the most important question is, what food should I avoid in hypothyroidism? The answer is, there is no such food. People have this myth that cabbage, cauliflower, soya proteins need to be avoided in hypothyroidism. This is not really true. There is only one rule about hypothyroidism. Take your tablet early in the morning on an empty stomach. Don't have anything to eat or drink except water for half an hour after you take your thyroid tablet. Beyond this, we do not have any other rules in hypothyroidism. If you are taking iron supplements, if you are taking soya protein, if you are taking calcium supplements, if you are using antacids, or if you are having green tea or an excessive amount of tea, make sure that you take it 2 hours after your thyroid tablet to ensure that this does not interfere with the digestion and absorption of your thyroid tablet. And always make it a rule that you take only iodized salt. Uniodized salt has no role in day-to-day life or in treatment of hypothyroidism. To conclude, the only message I am going to give you is, hypothyroidism is the mildest chronic disorder which is easily treated with a single tablet of thyroxine taken daily in the morning, and it has no major side effects, and only just ensure that you get yourself tested and take your thyroxine tablet. Thank you.